Hi, everyone. So we're going to be discussing the topic of drug therapy for weight management. Our group members are Brooke, Liora, Allison, Dorit, Cydnee, and myself, Sarah. So just a quick overview of what we'll be covering. First is the overview of weight management, then the anorexiants, lipase inhibitors, miscellaneous drugs, and lastly, current drugs. So starting with the overview, currently about 42% of the American population is obese. Comparing that to the total world population, that's 13% obese. Annually, $173 billion are spent on the medical costs related to obesity in the US, and every year there are 4.7 million premature deaths due to obesity. And then 1 in 5 children and adolescents in the world are overweight.
Hi, it's Cydnee. I just want to define our terms really quickly. So when Sarah says that over 40% of all Americans are considered obese, that means that they have a BMI of 30 to 34.9. So looking here at the BMI scale, BMI or body mass index uses your weight and your height to place you in a category that can indicate high body fat. So this is a scale that's still used widely by healthcare providers, despite the fact that it doesn't account for muscle mass, bone density. It doesn't measure body fat directly. It doesn't take into consideration racial or sex differences, and it doesn't consider overall body composition. So many studies have shown that BMI as a measurement of health is flawed, but that's what we use. So that's how we're going to define our terms today. So one of the best parts about this project was looking up the history of weight loss drugs. So of course we have like cigarettes as an appetite suppressant, but we have like a bunch of other really weird inventions that people used and were probably making a killing selling. So the middle article here is like basically a plunger that was being sold. You would just like stamp it onto a part of your body that you considered too fat, and it was supposed to dissolve the fat. Then on the right, this is for Fat Off, which is a cream that you just rub right into your skin, and it's going to dissolve your fat. Then a couple more. So top left corner, these are rubber undergarments that you would wear, and the thought being that you would like sweat your fat off as you wore them. In the middle is like a vibrating belt that they sold as something that would vibrate the fat off of you. And on the right, another cream, this time for cankles. So I know some of you are too young to remember these, but I just wanted to share a few commercials that still haunt my dreams. So we're just going to play a few seconds of each of these that will summon a memory.
Hydroxycut is now America's #1 selling weight loss product. Here's why.
I'm Eric from New York, and I lost 52 ugly pounds with Hydroxycut.
Hi, I'm Karen from LA, and I lost 32 pounds fast.
Subject.
She's losing weight without diet pills. He's losing weight without strenuous exercises. And how do they do it? By just getting rid of their excess body fluids. You'd be amazed at how much excess water weight and inches you carry around. And again you ask, how do they do it? They melt it off by saunaing. Yes, sauna, the Swedish way to get rid of excess body water easily and simply. Just
America's favorite home gym is more affordable than ever. Now you can get the all-new Bowflex Extreme for just $19 a month. Call the number on your screen for a free DVD or video and check it out. Bowflex's Power Rod technology delivers.
Ladies, when you put on that sleeveless dress, what's the first thing that sticks out? Our arms are the problem area that we never seem to be able to find the solution for until now with the Shake Weight. Shake Weight is the flab-busting breakthrough that trims your arms and shapes your shoulders at the same time.
Back of my arm. Hydroxycut is now America's #1 selling weight loss product.
Ladies, when you put on that
she's losing weight without diet.
So genuinely a nightmare of items, but interestingly, so Hydroxycut since then has been taken off the market because it causes severe liver damage. The sauna suit is a really good way to dehydrate yourself to death, Bowflex probably works, I guess, because it's exercise. I'm not even going to talk about the shake weight because it's just funny. So all of these solutions to weight loss that have been around for a long time. The weight loss industry today is a multi-billion-dollar industry. It's been shaping our perceptions of health since we were old enough to watch TV and see ads. So unfortunately, that's a huge reason why we are taught that obesity is a lifestyle disease that just affects people who don't have willpower. But thankfully, there's more and more research that comes out every year that reinforces how complex a disease obesity is. I'm going to give it over to Brooke.
Hi, this is Brooke. So weight actually has to do with genetics, culture, our environment, our ability to access quality foods, the medications we take, and so much more. What we now know now is that obesity is chronic, progressive, and multifaceted, and should be treated like other chronic, progressive, complex diseases. Lifestyle interventions like exercise and nutrition are essential, but for many people, these changes aren't enough. So bariatric surgery is not something that all patients are good candidates for, and not something that every person wants to undergo. So medications have been developed to help address obesity, and we are going to talk about one class of those right now, and that is the anorexians. So the prototype in this class was phentermine hydrochloride. It's used to speed weight loss in people who are overweight. The FDA approved it just for short-term use for weight loss, so 3 months or less. The mechanism of action inhibits the reuptake of both serotonin and norepinephrine, causes appetite suppression, which you can read the rest. Side effects are nervousness, palpitations, tachycardia, primary pulmonary hypertension, hyperactivity, dry mouth, constipation, and systemic hypertension. And then some other side effects that could occur that are a little more rare are impotence, insomnia, and unpleasant taste. Some contraindications for phentermine: if someone has moderate to severe hypertension, cardiovascular disease, hyperthyroidism, glaucoma, pregnancy, if you're breastfeeding, and then a history of drug misuse. And then you do not want to use this in children less than 16 years of age. So this drug you want to use cautiously in older adults. There's increased risk of adverse drug effects due to cardiovascular, renal, or hepatic impairment. Clearance of phentermine may be decreased in patients with renal impairment, resulting in an increased risk of toxicity, and tolerance to the drug may occur in as little as 4 to 6 weeks and is an indication for discontinuation of the drug. So it is habit forming and should only be used as prescribed. There are a few drugs that interact with phentermine. So some that increase the effects are tricyclic antidepressants, CNS stimulants, and then other I can never say this word, mimetic drugs, like epinephrine. And then some drugs that decrease the effects of phentermine include GI acidifying agents, methamphetamine, multivitamins, and urinary acidifying agents. So you just need to be cautious with those drugs. And then some nursing implications and teaching. You want to give the sustained release capsules before breakfast, swallow it whole, and do not chew, crush, or open them. Give immediate release preparations 30 minutes before meals. You want to assess the rate of weight loss, should be around 1 to 2 pounds weekly, and then monitor for elevated blood pressure, increased nervousness, hyperactivity, insomnia, dry mouth, and constipation. And then advise your patient that regular physical activity should be used in conjunction with medication and diet. And then take your last dose of the day 6 hours before bed to avoid possible insomnia.
Okay, this is Sarah. I'll be talking about lipase inhibitors. So the prototype is orlistat, also known as Xenical or Ollie, and it's used for the management of patients with a BMI greater than 30 or patients whose BMIs are greater than 27 while also having additional risk factors such as diabetes, hyperlipidemia, and hypertension. And it can also delay the onset of type 2 diabetes in pre-diabetic patients. Also, this is the only FDA-approved weight loss drug available without a prescription. For the MOA, it binds to gastric and pancreatic lipases in the GI tract, and it decreases the absorption of dietary fats. This is taken as a PO medication, and some common side effects to be aware of are abdominal pain, oily spotting, increased fecal urgency and incontinence, flatulence with discharge, and fatty stools. And then some less common, more severe side effects are pancreatitis, liver dysfunction, and liver failure. This drug is contraindicated for patients with hypersensitivity, chronic malabsorption syndrome, or cholestasis. For the nursing implications and patient education, it's important to administer the medication either with a main meal or up to an hour after the meal is eaten. So if they skip a main meal or eat a meal that contains no fat, then they should skip the dose, and then also avoid eating meals that contain a very high percentage of fat. Orlistat presents the absorption of fat-soluble vitamins such as A, D, E, and K. So you want to make sure you give the patient a daily multivitamin either 2 hours before or after taking the med. Monitor patients' weight loss and BMI, being sure to take daily weights and tracking their I's and O's. Monitor coexisting conditions such as diabetes, dyslipidemia, hypertension, and metabolic syndrome, and then adjust medications accordingly as ordered by the provider. And then to continually assess for and educate the patient about the common side effects that usually subside after a few weeks of taking the medications, such as fatty stools and oily spotting.
Hi guys, this is Liora, and let's talk about some miscellaneous drugs for weight loss. Okay, so the first one we are going to be discussing is bupropion naltrexone, or also known as Contrave. This is a really cool drug. So for the MOA, the mechanism of action, basically we have two drugs that are going to be combined into one. You have this bupropion drug, and it's an antidepressant that works as a weak inhibitor for the reuptake of dopamine and norepinephrine. So it's a weak inhibitor for these things. And then you have the naltrexone, which acts as an opioid antagonist. And when you take these two drugs and you combine them, they impact a specific area in the brain that is involved in food intake, specifically the hypothalamic appetite regulation center and the mesolimbic dopamine circuit reward. That is a mouthful, but what all that fancy stuff basically means is that this helps people manage their obesity, whether they're overweight or obese, they're able to lose weight. The route that somebody would use is PO, so they take it by mouth. The side effects for this would be suicidal thoughts and behavior. They can have an anaphylactic reaction, hypertension, they can be tachycardic, hepatotoxicity, and insomnia. For contraindications, you don't want to give this to somebody who has a seizure disorder. You don't want to give this to anybody who's pregnant, who has hepatic impairment. And you also want to be careful if they're going through withdrawals of alcohol, benzodiazepines, barbiturates, anti-epileptics, and also if they're within 14 days of using an MAO inhibitor. That word got dropped, but it's supposed to be there. For RN implications, as a nurse, there are several things you want to do. You want to monitor for weight loss. You want to check the mental status and like the mood changes of the individual. You're going to want to monitor the BP and the heart rate, especially if they are a hypertensive patient. You definitely want to watch out for that. And then you're also going to watch out for signs of an anaphylactic reaction, which is like hives, urticaria, and yeah. And for education, again, going back to the signs and symptoms of suicidality, you want to watch out for that. And you want to tell the patient that if they are feeling those emotions, they should contact a healthcare professional immediately. You're going to want to tell them to watch out for signs of liver damage. You're going to want to teach them that it's dark urine, stomach pain that lasts for a few days, yellowing of the skin. And lastly, you're going to tell the patient to adhere to a calorie-reduced diet and physical activity.
Hi, it's Dorit. And the next drug we're going to talk about is lorcaserin, also known as Belvic. This drug was in our textbook. However, in 2020, it was banned by the FDA due to the increased risk of cancer in patients. The method of action or the mechanism of action is it activates serotonin 5-HT receptors, stimulating select neurons in the hypothalamus that suppress appetite and leading to decreased hunger and food cravings. It's used in obese patients. It's given PO. Side effects to watch out for are constipation, dry mouth, nausea, hypertension, peripheral edema, cognitive impairments, depression, and hallucinations. Some counter indicators are severe renal impairments, pregnancy, breastfeeding, and children. And you want to hold this medication in patients taking SSRIs, SNRI, TCAs, MAOIs, and antipsychotics. And then some implications would just be to monitor weight loss, prolactin levels, blood glucose levels, and to educate the patient and the family to notify their healthcare professional with any thoughts of suicide.
Okay, so this is Allison. I'm going to talk about current weight loss drugs. So first we've got semaglutide, which is Ozempic. I'm sure everyone's heard of it at this point. Everyone seems to be taking it. So it leads to a lot of unexplained fast weight loss among the rich and famous. So this is a GLP-1 receptor agonist, and how it works is the drug binds to these receptors and stimulate the release of insulin, which not only drastically reduces the hunger of these patients, but also slows the gastric emptying so that they feel fuller longer. And pretty much, I know a girl who takes it and she just really doesn't eat anymore. Used to improve blood sugar in type 2 diabetes, also helps lower their A1C, and in that lowers their risk for stroke and MI. That's what it's supposed to be used for. And the route is sub-Q injections that are given 1 time per week. So it's not advertised as a weight loss drug on their website. It even says like not a weight loss drug. But it does result in a 15% body weight loss on average. Some patients have lost even up to 25% of their total body weight, which are results typically only seen in a sleeve gastrectomy. Some side effects of Ozempic, I feel like they haven't really come out yet, but the ones that they say are nausea and vomiting, diarrhea, abdominal pain, pancreatitis, vision changes, hypoglycemia, kidney failure, and jaundice. So the 2 really big contraindications are history of either of these 2 diseases or syndromes. So the first is medullary thyroid carcinoma, which is called MTC for short, and the other is multiple endocrine neoplasia syndrome, MEN2. Yeah, you like absolutely cannot take this drug if you have a history of either of those. It also is not meant for children or anyone who's pregnant or lactating. So some nursing implications is to monitor the kidney function prior to administration. And it's really important to gather all their medical history to make sure they don't have any of the aforementioned issues. The second drug I'm going to talk about is tirzepatide, which is called Mounjaro is the brand name. It does honestly the exact same thing as Ozempic. Improves the blood sugar in diabetes as well as lowers A1C. Like I said, this one is not advertised as a weight loss drug either. Exact same side effects as Ozempic, except this one comes with some constipation and indigestion, but still kind of like that pancreas issues, kidney failure, vision changes, jaundice, etc. This is also contraindicated in the MTC and the MEN2, but did not say anything about being contraindicated in pregnant women. So something to note there. monitor kidney function prior to administration and gather their medical history as a nurse. And then teaching, you want to use backup birth control at least in the first month. And then anytime there's any dosage changing going on, because in those like initial stages, I guess it can kind of make your birth control not work so well. Okay, so questions for the class. Question number 1 is, a patient has a body mass index of 26. What is this patient considered to be? A, underweight, B, overweight, C, obese, or D, desired weight? And the answer is B, overweight.
Question 2, a nurse is teaching a patient who is obese about the effects of phentermine. How best can the nurse explain phentermine's mechanism of action? A, this drug will dissolve the fat around your midsection. B, this drug will decrease your appetite. C, this drug will cause an increase in calories burned each day. Or D, this drug will prevent gluconeogenesis, resulting in weight loss. The answer is B. This drug will decrease your appetite.
Question number 3. A patient is being educated about her new weight loss medication, Orlistat. Which of the following teaching points by the nurse is most relevant? A, the patient will need to completely eliminate fats from her diet. B, the patient must increase her fiber intake. C, the patient's stool will contain fat. Or D, the patient's appetite will decline over the first 48 hours. And the answer is C, the patient's stool will contain fat.
Okay, question 4. A patient is depressed about his inability to lose weight. He tells his nurse that his mother lost a great deal of weight in the 1970s with the use of amphetamines. The nurse should teach the patient that amphetamines are not a treatment option because A, clinical studies have shown amphetamines to be ineffective. B, modern lipase inhibitors have superseded amphetamines, sorry. C, amphetamines are extremely expensive and not covered by most health insurers. Or D, amphetamines carry a high risk of dependence and abuse. And the answer is D, they carry a high risk of dependence and abuse.
Question 5. A patient has asked her nurse practitioner to prescribe lorcaserin for weight loss. What variables will mostly affect the nurse's decision? A, lorcaserin has been taken off the market due to increased risk of cancer. B, lorcaserin is prohibitively expensive and not covered by most insurers. C, lorcaserin used requires weekly blood work. Lorcaserin only works in male patients over 40 years old. And the answer is A. Lorcaserin has been taken off the market due to increased risk of cancer.
And there are some references.
Nice.